Well, this is a 2,600-page bill with 10,000 pages of regulations.
More than that.
So that's,
More than that.
well, you're a doctor, so you know these things. I was hoping and praying there'd be no doctors in the audience when I gave this speech, and here you are. But the point is, I have 30 minutes, so that's like 418 pages per minute that I have to cover. And I am cognizant of that fact. My friend Jim Clymer just gave me a note that said, "You're the only thing that stands between me and lunch." But we do need to talk about the Patient Protection and Affordable Care Act, Obamacare we'll call it for simplicity's sake, and its effect on the American people. Its effect on the American people is that it will eventually decide, I predict, whether many of us live or die and how our lives are conducted. At the same time, we consider it. Congress is debating it and debating whether or not to raise the debt ceiling to more than $17 trillion. Its money problems are inescapable. You can say what you will about it. You might be in favor of it. On USA Today yesterday, that you probably got in your room, there was a young lady on the front page who was interviewed about it, and she said, well, everybody needs health care. Everybody needs health insurance, whether you're 25 or 55, I think she said. Well, okay, well, that's the assumption. Everybody needs health insurance, therefore the government is obligated to provide it to us by force, whether we like it or not. Even the Congressional Budget Office, which is always conservative in its estimations of money, says this will cost $1 trillion over the next 10 years. $1 trillion when we already have 17 trillion of debt. So this act is unconstitutional, it's unlawful, and it's a violation of the rule of law. And by that I just mean that it's for us and not for them. The rule of law applies equally across the board from the president on down to us, not just to us, but this law applies just to us. See, Congress, as you all probably know, has exempted itself. It chose not to be covered. And the way they explained why they were not going to be subject to Obamacare was it would have a chilling effect on their staff. They might lose some of their best staff people, they said, because this law that they gave us is so horrible, even their staffs refuse to work for them if they had to be subject to it. But they don't care about our staffs. They don't care about people like us who may have employees or may be employees and might not like it. That is irrelevant. But the fact is, I have for you today some good news, some bad news, and then some really bad news. So first, let's look at the bad news. If Mr. Peck there will go to the next slide, you can see that there are 4 basic categories of people covered under this act. And there should be a slide up there with all 4 of them listed on it. The 4 basic categories represent every American. We all fall under these 4 categories. Number 1, you're currently uninsured or underinsured. Number 2, you have private insurance at your own expense. Number 3, you are insured through your employer. Number 4, you receive or soon will receive Medicare. That is going to be me in 3 days. October 11th, believe it or not, I will be 65 years old. And so as of October 1st, I'm going to be a victim of Medicare. I've been perfectly happy with my group policy I've had through my law firm for decades now, but the government says we don't care. You are on Medicare, whether you like it or not. So that is the way it is. Now, the first one, you are currently uninsured or underinsured. So there should be a slide up there with that information on it. You are currently uninsured or underinsured. 20 to 30 million people estimated by the government fit into this category. This is the 20 to 30 million people that this act is all about. The uninsured and underinsured. These people cannot be refused coverage for any reason, whether they are chronically ill or whether they want coverage or whether they don't. They can refuse to accept it, and if they do, they will be required to pay a penalty. In 2014, that penalty is $285. In 2015, it'll be $975. In 2016, it'll be $2,085. So it's going up progressively, but still, it is far less in most cases than what the premium will be. Average across the country, premium $249 a month. This information just came out last month. There are many different levels of premium and many different levels of coverage. They call these bronze level, silver, gold, and platinum. And these refer to the cost of the coverage and the coverage itself. I think bronze, the lowest, is obviously the cheapest, and it covers about 60% of the health issues that you might have. So it still leaves you 40% uninsured if you buy it. Now, the interesting thing about this is if you do not want the coverage and you're paying the penalty, then you're still uninsured unless you come up with some other arrangements. You're still out there, as the government fears, as a drag on the system, showing up at the emergency rooms when you have a problem and so forth. But if you want the coverage, and the government, the Obama administration, has an army of people it refers to as navigators to show these people into the system, to steer them, to navigate them through the red tape, and to convince them that it is a good idea so they will take this coverage. Well, if they do take the coverage and they cannot afford the premium, and that is determined by where they stand on the government's poverty line. The poverty level for a single person right now is $11,490, I think. And if you make 400% of the poverty level or less, that's about, what, $44,000, then the government will pay this premium for you, at least in part. And so the more you make, the premium will be prorated. But the government is accepting the responsibility for this, estimated to be $35 billion the first year, although nobody knows. Nobody knows much of anything about this act. Nobody knows what it's going to cost, how many people are going to enroll in it, or how many people there are out there. But we know that you're required to start on Tuesday, October 1st, signing up if you are uninsured or underinsured through online exchanges, which nobody knows exactly how to do that yet. And the government estimates that about 10 million of these people that are uninsured are Hispanic, Spanish-speaking people. And there's no Hispanic online exchange right now. So it is a mess, and that is the best way to describe it, I guess, right now. But that is part of the bad news of all this, but it'll get better or more interesting here in a minute. The interesting thing is these people, the uninsured, for the most part, younger, healthier people coming into the system, 20 to 30 million, the government estimates, suddenly coming into the healthcare system, but the infrastructure of healthcare hasn't changed. It is still the same. In other words, the same number of doctors, the same number of hospitals, the same number of nursing homes, hospices, and the like. So the system suddenly taking on 20 to 30 million new people with the same infrastructure to support it. That is the way it is, and it is going to be a real mess when that starts happening. We'll look at that as we move through this. Let's look at category number 2. You have purchased private insurance on your own. That's already happened prior to October 1st. You will have purchased private insurance on your own. Only about 4%, the government says, of the country fits into that category. If you're in that category, as the president told us, you can keep your policy and you can keep your doctor, but you can't keep your money, because your premiums are going to be much, much higher. Why? Because all of those 20 to 30 million people coming into the system have to be insured. They cannot be refused for any reason. If they have a chronic illness, if they have acute liver failure or whatever it might be, they have to be covered, and somebody has to pay for that. So that cost is being socialized across the entire system. That's why the premiums that you hear so much about are going up. Now, the next category is you're covered by your employer. I suspect most people fit into this category, and there are two different levels of it. 50 or more employees. If you're an employer who has 50 or more employees, then you are required to cover each and every one of those people or pay a $2,000 penalty, fee, tax, Chief Justice Roberts called it. Thank you, Bob. This $2,000 penalty is what the government refers to as the employer mandate. You've heard about it, I'm sure. The employer mandate, as of July of this year, has been delayed for 1 year. They don't have to comply with it for a year. That's for people who have 50 or more employees. Now, let's say that you were an employer and you had 60 employees, and you did not provide health coverage to those people. They were just on their own. What would you do? You might consider laying off 11 of them, or you might consider putting 11 of them on part-time basis so that you were no longer an over 50 employer. This has been happening across the country to tens of thousands of people. Everywhere you look, people are losing their jobs due to reactions to Obamacare or being put on part-time status. Like, let's say that a person works at McDonald's, and McDonald's says to avoid the penalty of Obamacare, you're going to go to 29 hours a week. That person goes down the street to Burger King and gets a part-time job working 20 hours a week. Well, according to the government, they just added one new job to the employment rolls. But in reality, this person is now part-time working 2 jobs. Now, people with less than 50 employees, they're okay. They can keep their group policy. That's where I fit in. My group policy goes on just without me. So all I have to do is pay for it. A lot of people, you find these policies in the less than 50 groups. Number one, the premium goes up quite a bit. We signed a preemptive surrender in our policy where we agreed to pay a certain premium increase to avoid a more massive increase at the first of the year, which is when this really starts, January 1st. But still, the other thing you'll find for those employers is that a lot of people will come into the group who were not in it before. Let's say you have a woman or a man working for you, and husband or wife works somewhere else at a larger employer who has what they consider to be a better plan than yours, and so they accept coverage through that plan. They don't need they don't want to be in your group. Then all of a sudden, husband or wife is a victim of Obamacare and gets laid off because his employer doesn't want to pay the penalty. So now the other spouse is coming back to you saying, I'd like to be covered. So your group rates are going up and up and up. That's the way it goes. The final category, you will receive, you receive or will soon receive Medicare, which, as I said, is me. And in some ways, this is actually good news for all of us people on Medicare now. No additional cost to us. I mean, everything's free, isn't it? I mean, that's what I've heard. I can't wait. Of course, I've never been sick. People say, well, who's your doctor? I said, well, I don't have one, which is pretty scary, actually, entering into this stage of life. I'm going to experience that someday, I guess. 10,000 people every single day, 7 days a week, enroll in Medicare, 10,000, and that's expected to continue for 15 years in the future. So remember that. There is some more news coming up about Medicare that we'll talk about. This is part of the bad news, don't forget. So let's move on to the Independent Payment Advisory Board. The Independent Payment Advisory Board is going to empower politicians and bureaucrats to make life or death decisions for you, for us, especially us Medicare people. It has been directed to cut Medicare spending by $716 billion over the next 10 years. What do you think is going to happen to the Medicare system when it takes a $716 billion cut? Well, it's already happening. Just talk to any doctor or nurse that you want to who practice in the hospitals, and they'll tell you what is happening. This board is completely independent. The word independent actually does mean independent. It means that it's not subject to anybody. For example, now, let's look back a couple of months ago. You probably remember this case. There was a 10-year-old girl who needed a lung transplant, her doctor said, and so she was refused this to be put on the transplant list, and he appealed that, her doctor did. Somehow the appeal worked its way up the system and reached the desk of Kathleen Sebelius, the Secretary of Health and Human Services. And she said no transplant for this 10-year-old girl. And the reason? Because she's 10 years old. That's the only reason. Her life is not worth saving under this new system. This is what we are looking at right now. It is a completely independent board, presidential board appointed. It's independent of the voters. It's appointed, not elected. It's independent of Congress. It's independent of the judiciary. In other words, there is no appeals process under this new act. If your doctor says you need a transplant and the board says no, that's it, period, end of story. There is no further appeal. What is going to happen to all of us people on Medicare when we need a heart operation or whatever it might be? The database coming up here in a minute that the Independent Review Board feeds information into. Well, this gentleman here, he stops at the cigar store every once in a while, and he stops at the liquor store more often than he should. So let's just not give him the heart transplant or whatever it is that he might need. That is in our future, and that's why I say bureaucrats will decide who lives and who dies. Now, the next slide, you should be looking at the National Health Information Database. It was originally established by TARP, the Troubled Asset Relief Program, in 2009 as part of the housing collapse. You remember that $700 billion that the government gave away to the banks and so forth. Well, they took part of it to fund this database. It's the source of data mining for the Independent Review Board, because all medical records from every medical provider who files electronic claims has to be sent to this database. There's always been a tradition in the law, I guess you could call it a tradition, that the patient owns the records and the doctor or the hospital are the keeper of the records. And in the litigation process, if you want somebody's medical records, you have to get a signed authorization from that person to obtain them. Well, under this act, all those records are being sent to this database and being combined with other records from the agencies that you all know about, instantaneously available to the board who makes the decisions about whether you live or die. This is all part of Obamacare. Well, that's the bad news. Now we come to the good news. It's actually programmed to fail, this act. Just look at the cost that we just talked about. Estimated 20 to 30 million new patients entering the system at once, 10,000 people a day coming into Medicare at once. The relaxed standards that we're seeing across the country now, allowing illegal immigrants into the system, with more coming each day. exploding numbers of patients with the same infrastructure, the same numbers of doctors and hospitals, but is it really the same number as more and more doctors leave the profession, retire early if they're able, or just quit and do something else? As hospitals close for lack of reimbursement, no new hospitals are being built. There's no $1 billion in this bill to build new hospitals or anything to take care of all these new people. I was on a flight the other day, and this gentleman sitting beside me saw me reading an article by a doctor named Elizabeth Vliet, which you should write that name down and look it up. It's spelled V-L-I-E-T. She's probably the most knowledgeable person in the country on Obamacare, but I was reading some of her material, and he saw it, and he said, tell me what this is about. And he said, I'm a gastroenterologist, and I'm very nervous about it. I said, well, I'm a lawyer, and I'm very nervous about it. So we've got that in common. But the point is, nobody knows exactly what's going to happen, but it's my prediction that it's programmed to fail and intended to do that as hospitals are paid less. By the way, there's an incentive built into this program for hospitals in the Medicare to an incentive. The less seniors they treat, we call them seniors, I always hate that word, but the less Medicare patients they treat, the less they do for them, the more they're paid. So they have an incentive built in to deny treatment for different things. This is what's coming, and it's why I say the program is, the bill is programmed to fail. Now, coming to the end of my time, in summary, you are not required to buy health insurance, but if you don't buy it, you are required to pay a penalty. Sometimes the penalty will be less than the cost of the premium, thus forcing the government to subsidize all the premium costs at billions and billions of dollars a year. Enrollment in online exchanges starts October 1st, 2013 and runs through March 2014. What happens if you don't enroll? Well, the IRS is programmed to track you down. They have 18,000 new agents that they hired to do just that. How they're going to track down someone who doesn't work and who is a dropout of the system is anybody's guess, but that's what they're supposed to try to do, to enforce this penalty. How are they going to enforce it if you don't pay taxes anyway? Nobody knows, but they're going to try. About half the states have refused to set up online exchanges, but the federal government doesn't care. They set them up for them. And 13 states have refused to accept the administration's navigators to steer them into the system. Now finally, the really bad news. Rising premiums, longer waits, fewer choices appear to be in our future. And by the way, this is not some pipe dream that we talk about in philosophizing. This is actually here. I mean, this is T-3 right now. This is definitely going to happen. You know, it's like that old movie, Meteor, you may have seen it, you know. He said this rock is out there and it's the size of Texas and it's definitely going to hit us. This is definitely going to happen. The goal is to force everyone into a government-controlled system and eliminate cash-based medical care completely. This is the precursor to a single-payer system completely funded by the government, with the government and its bureaucrats in control of who lives and who dies. I'm not just guessing at this. You can go and Google and find a video of the president when he was, before he became president, saying this was the ultimate goal, a single-payer system. Harry Reid said it the other day, famously. Yes, he said, that is definitely the goal. So the program to fail is so that when it does fail, then a single-payer system can be enacted. That just means, you hear that term a lot, it just means the government pays for everything. And since there's no way it can afford to do that, what do you think is going to happen? Some people are going to have to be allowed to die. I mean, that's something that we all face, but we would like to at least have ordinary medical care that we've paid for our entire lives. This is the government deciding these things for us. As Thomas Jefferson's letter once said, the decision that Americans will face is whether they will be free and make their own decisions or whether they will be subject to the decisions of a tiny elite. It's not much different today. My time is up, folks, but let me just close by telling you about that Obamacare is like that old adage you hear sometimes about old age. If you don't like it, just be patient. It doesn't last long.